Gibson Kohli here with Snackable Health, and it's really becoming a big issue now. Are we still in a pandemic? Is this the sixth wave of a pandemic, or we entered the endemic phase? There was a great New York Times article the other day, Pyle, that looked at this in the centrist view from epidemiologists and disease experts, infectious disease experts, seems to be that we're kind of in an endemic phase, which kind of sounds good, right? That we've gotten through the pandemic. That's the good news. The bad news were some of their predictions, namely that we would probably have about 100,000 to 250,000 deaths a year attributable to COVID, dying from COVID, not just dying with COVID. And that is many, many times greater than, say, the flu. They also say with all the new variants, it's likely we're all going to get infected multiple times. That's the bad news. The good news is that we've probably 95% of us have either been vaccinated or have been infected. And we have increasing immunity, both natural immunity and vaccine immunity. So, yes, we're going to come down with COVID a lot more because of the variants. The good news, though, is that, we're going to have less and less severe disease. But from a public health perspective, if you have that many people coming down, millions of people coming down with COVID and the variants, from a public health perspective, we're going to have a lot of deaths. Now, the other thing they didn't talk about that I'm quite worried about is long COVID.
Mhm.
And, I was dumbfounded to see this number come out of a think tank the other day. There was a meeting about long COVID. They concluded that about 43% of people have some symptoms of long COVID. That's an astonishing number. Now, they don't really know what's causing it, whether it's residual virus, an autoimmune process, or some inflammation of the brain with your microglia. There's a lot of theories, but the public health perspective is pretty staggering. What are some of your thoughts?
Yeah, Mike, I think you make such excellent points. I mean, the biggest thing I want to emphasize is that even if we, let's say, end up in the endemic phase, that doesn't mean that this is a benign illness. And I think that's the misperception that a lot of us have, is that if something goes from pandemic to endemic, we don't have to worry about it. But the idea that hundreds of thousands of lives can still be lost from it, the idea that you could end up with long sequela, not just long COVID, but potentially other complications such as autoimmune diabetes, brain atrophy, and dementia. A lot of the other things that we're seeing occurring with COVID, all of those are things that are going to have implications for public health for many years. I also continue to worry about the cardiovascular implications because we know that the virus can affect the blood vessels as well as the heart. So, what does this mean for our risk of heart disease 10 or 20 years down the road, especially for one of those people that has had it multiple times? Are we going to get more inflammation in those blood vessels and a higher risk? So I think the take home message to me really is that regardless of what we label the virus phase at what we're in right now, we have the tools now. We have mitigation measures, we have vaccines and boosters, we have antivirals that we need to start early. We have testing, and we need to use all of those tools to really try to minimize our chances of getting infected or reinfected as we continue to sort of live alongside this virus.
Yeah, I think that's a great point. Personally, I'm going to, when I get on planes, crowded situations like that, I'm going to continue to mask. I don't care what people think. This is probably not going to be over for a long time. I think it's going to become more and more and more like a common cold, but that's many, 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 many years in the making. And I certainly don't want to come down with long COVID or something like that. Thanks for joining us today, and thanks to all of you for joining us here at Snackable Health.